Article 40 of the Irish Constitution covers the fundamental rights and personal rights of the Irish citizen, and Article 43.3 is the 8th Amendment, which introduced a constitutional ban on abortion in 1983 by recognising the right to life of both the mother and her unborn child. Article 43.3 states as follows: the state acknowledges the right to life of the unborn and, with due regard to the equal right to life of the mother, guarantees in its laws to respect and, as far as practicable, by its laws to defend and vindicate that right. Thanks to the 8th Amendment, it is estimated there are tens of thousands of Irish citizens alive today who would otherwise have been killed before birth. Some of them may even be your friends. In fact, an analysis of the international abortion rates in the actuarial report, which was commissioned by the Pro Life campaign, state that at least 100,000 babies' lives have been saved by the 8th Amendment. Not everyone realises what an abortion is, including those who have had one. Abortion can be defined in many different ways, but generally speaking it is seen as a medical procedure to end a pregnancy so that the baby is not born alive. In other words, it is the direct and intentional killing of an unborn baby. We were all here once, nourished by our mother. Every unborn child is a new and unique individual from the moment of conception, but abortion stops a beating heart. A baby's heart is beating 18 days after conception, before most mothers know they are pregnant. If you are pronounced dead when your heart stops beating, why aren't you pronounced alive when your heart starts beating? You are alive in the womb. If you are not alive, why are you growing? Why is your heart beating? Now let's meet Samuel Armas, born in 1999, who is the child shown in a famous photograph dubbed "The Hand of Hope." The image on the left shows Samuel as a baby in the womb, undergoing a surgical procedure at Vanderbilt University Hospital, Nashville. We see his tiny hand extending from the opening in his mother's uterus and touching the surgeon's fingers during his open fetal surgery to correct a spina bifida lesion, and then in the photo on the right as a very happy 16-year-old. Dr. Joseph Brunner and Dr. Noel Tulipin developed the technique for correcting certain fetal problems on babies while in the womb, allowing the pregnancy to continue until normal full term. This was the surgical team's 54th operation.
First trimester surgical abortion called suction D&C, dilatation and curettage. This is the most frequently performed abortion and is used typically from 5 to 13 weeks of pregnancy. After administering anesthesia, the abortionist uses a speculum like this. This is placed inside the vagina and opened using this screw on the side, allowing the abortionist to see the cervix, the entrance to the uterus. The cervix acts as a gate that stays closed for the duration of pregnancy, protecting the baby until it is ready for birth. The abortionist uses a series of metal rods called dilators, like these, which increase in thickness, and inserts them into the cervix to dilate it, gaining access to the inside of the uterus where the baby resides. The baby has a heartbeat, fingers, toes, arms, and legs, but its bones are still weak and fragile. The abortionist takes a suction catheter like this one. This is a 14 French suction catheter. It's clear plastic, about 9 inches long, and it has a hole through the center. It is inserted through the cervix into the uterus. The suction machine is then turned on with a force 10 to 20 times more powerful than your household vacuum cleaner. The baby is rapidly torn apart by the force of the suction and squeezed through this tubing down into the suction machine, followed by the placenta. Though the uterus is mostly emptied at this point, one of the risks of a suction D&C is incomplete abortion, essentially pieces of the baby or placenta left behind. This can lead to infection or bleeding. In an attempt to prevent this, the abortionist uses a curette to scrape a lining of the uterus. A curette is basically a long-handled curved blade. Once the uterus is empty, the speculum is removed and the abortion is complete. The risks of suction D&C include perforation or laceration of the uterus or cervix, potentially damaging intestine, bladder, and nearby blood vessels, hemorrhage, infection, and in rare instances, even death. Future pregnancies are also at a greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. second trimester surgical abortion called dilatation and evacuation, or D&E. A D&E is performed between 13 and 24 weeks of pregnancy. After administering anesthesia, the abortionist uses a weighted speculum, like this one, that opens the vagina widely. Because second trimester babies are so large, this greater access facilitates a late-term abortion. Late-term abortion requires that the cervix be prepared 24 to 48 hours in advance with laminaria. Laminaria is a type of sterilized seaweed that absorbs water over 8 to 12 hours and swells to several times its original diameter. Once removed, metal dilators can be used to further open the cervix as needed. Once the cervix has been stretched open, the suction tube is placed inside. A baby at 20 weeks gestation is as big as the length of my hand, from head to rump, not counting the legs. The suction machine is turned on, and pale yellow amniotic fluid surrounding the baby is suctioned out through the catheters. But babies this big, they don't fit through catheters this size. The baby's bones and skull are too strong to be torn apart by suction alone. This is a Sofer clamp. A Sofer clamp is made of stainless steel. It's about 13 inches long. The business end is about 2.5 inches long and 1/2 inch wide, and there are rows of sharp teeth. This is a grasping instrument. When it gets a hold of something, it does not let go. The abortionist uses this clamp to grasp an arm or leg. Once he has a firm grip, the abortionist pulls hard in order to tear the limb from the baby's body. One by one, the rest of the limbs are removed, along with the intestines, the spine, and the heart and lungs. Usually the most difficult part of the procedure is extracting the baby's head, which is about the size of a large plum at 20 weeks. The head is grasped and crushed. The abortionist knows he has crushed the skull when a white substance comes out of the cervix. This was the baby's brains. The abortionist then removes skull pieces. He removes the placenta and any leftover parts of the baby with a curette, scraping the lining of the uterus for any remaining tissue. The abortionist then collects the baby parts and reassembles them to make sure that there are 2 arms, 2 legs, and all the pieces. Once all the parts have been accounted for, the abortion is complete. For the woman, this procedure carries a significant risk of major complications, including perforation or laceration of the uterus or cervix, with possible damage to the bowel, bladder, and other maternal organs. Infection and hemorrhage can also occur, which can even lead to death. Future pregnancies are also at greater risk for loss or premature delivery due to abortion-related trauma and injury to the cervix. I'm Dr. Anthony Levatino, and in the early part of my career as an OBGYN, I performed over 1,200 abortions. One day, after completing one of those abortions, I looked at the remains of a preborn child whose life I had ended, and all I could see was someone's son or daughter. I came to realize that killing a baby at any stage of pregnancy for any reason is wrong. I want you to know today, no matter where you're at or what you've done, you can change. Make a decision today to protect the preborn. Thank you for your time.
I will no longer do any more abortions. When you finally figure out that killing a baby that big for money is wrong, that it doesn't take you too long to figure out it doesn't matter if the baby is this big or this big or this big or maybe even this big, it's all the same. And I haven't done any since then, and I never will.
The following are abortion statistics on women from the Republic of Ireland, issued by the British Department of Health. In 2001, there were 6,673 abortions, and in 2015, this was reduced to 3,451. The number of abortions have dropped for the 14th time since 2001. This decline was despite an increase in population and an increase in women aged 15 to 44, a decrease in abortions of 48.3%. The following are abortion statistics on women from Northern Ireland issued by the British Department of Health. In 2001, there were 1,577 abortions. In 2015, this was reduced to 833. The numbers of abortions on women from Northern Ireland have also continued to drop over the same 14-year period, which is a decrease of 47.2%. The data from the British Department of Health show, as in previous years, that no abortions were carried out in emergency to save a woman's life, despite previous propagandist statements. The reduction in Irish abortions is very gratifying. Over 100,000 lives have been saved thanks to the 8th Amendment.
One of the biggest arguments of pro-abortion activists is that abortion is medically necessary. What's your position on that?
We hear all the time how abortion, including especially late-term abortion, is necessary to save women's lives. Nothing could be further from the truth. I spent 9 years working at a tertiary medical center. I mean, there are only certain hospitals in the country that are designated to take care of the really, really high-risk pregnancies. You don't want to duplicate the effort, it's expensive. So these hospitals get referrals from the surrounding area. And Albany Medical Center in Albany, New York, where I worked, was one of them. I was faculty at the hospital for 9 years. And I saw hundreds of cases of really severe pregnancy complications, cancers, heart disease, intractable diabetes out of control, toxemia of pregnancy out of control. And I saved, in those 9 years, I saved hundreds of women from life-threatening pregnancies. And I did that by delivering them, by ending their pregnancy by delivery, either induction of labor or cesarean section.
Delivering the baby.
Delivering the baby. And I always tell people, in all of those years, the number of babies that I was obligated to deliberately kill in the process was zero, none. And I'll give you an example. The key point about late-term abortion that so many people miss is that it takes days to prepare the cervix. This is not a natural situation by any stretch. If you're going to dilate a cervix sufficiently, that starts off essentially as a pinpoint, large enough to dismember or tear apart a baby this big, that cervix has to be dilated, and that can take anywhere from 24 to 72 hours. And especially when you're talking about later term pregnancies. Most life-threatening situations, the vast, vast majority of life-threatening situations in pregnancy are not going to arise until 24, 25, 26 weeks of pregnancy and higher. And when you're talking about that, you're talking about abortion procedures that take 2 and 3 days to prepare the cervix. And I'll give you a classic example. This is a real case. A lady came to the hospital at 27 weeks of pregnancy with severe toxemia. Her blood pressure, you know, a normal blood pressure is about 120 over 80. Her blood pressure was 220 over 160. Okay, this lady would literally be minutes or hours away from a stroke. What do you do in a situation like that? We stabilized her, brought her back, did a cesarean section, had her delivered within an hour of arriving at the hospital. She and her baby did just fine.
Amazing.
Now, let's say we wanted to use abortion to save her life, okay? If with that kind of blood pressure and that kind of problem, if we waited 2 to 3 days to get her cervix prepared, she would never make it. She would have been dead. And that's a perfect example. You never need late-term abortion to save a woman's life. If necessary, you accomplish the delivery. Now, did every one of those children make it because they were preterm? No. But they all had a chance, and most of them did make it.
What you're saying is so amazing, Dr. Levatino, because a lot of people never hear this. They assume when abortion is brought up that it's necessary to kill that child, sometimes to save the mother's life. But you're saying it may be necessary to deliver the baby, but you never have to purposely go and kill that child.
That's exactly what I'm saying.
So why is this such a huge argument for pro-abortion advocates to say it's necessary to kill to save the life of the mother?
That argument I don't understand. In my experience over almost a decade, I never had to kill deliberately a single child to save a woman's life during pregnancy. There's a wider discussion, though. Politically, always listen very carefully to the words that are being used. You know, we need to pass law X, Y, and Z because it protects women's health. Bill Clinton, I will be happy to sign a ban on partial birth abortion so long as it includes an exception on women's health. Well, what do they mean? Now, I have a law degree, and every lawyer knows that every single word has meaning. And what Roe didn't do was define the word health. Doe versus Bolton did. It says that health, the term health, includes a woman's physical health. Okay, but it didn't say how badly impaired her physical health had to be for it to be a problem. It includes her mental health. Okay, but again, how bad does her mental health has to be? I suppose I can imagine, I never saw one, but I can imagine a case of if the woman's going to have a psychotic break because of her pregnancy, that certainly seems like a severe mental health problem. How about she's under tremendous stress? How about, I just don't think I can cope with this pregnancy? That's mental health too. It includes her economic health. Whoa, how much money do you have to be economically healthy? Not defined. And if that wasn't enough, it includes her social health. What in blazes does that mean? What it means then when a politician says, I would be happy to support your bill so long as it has a health exception, translation, I would be happy to support your bill so long as it contains an exception so big that the bill is of no real practical effect.
The ban on abortion in Ireland means that our doctors protect the lives of both mother and baby. This has led to excellent standards of maternal health care, where both mother and baby are best cared for and women's lives are never put at risk. Ireland remains one of the safest places in the world for a woman to have a baby. What about the Savita Halappanavar case? Savita Halappanavar died tragically in 2012 from an infection of her blood, called septic shock. The inquest into her death found that the cause of her death was medical misadventure. The unavailability of legalised abortion was not a factor. It has always been standard practice for doctors in Ireland to intervene, to give all necessary treatment to any pregnant woman, even if that treatment may result in the unintended death of the baby. What about the case of rape or incest? Rape is an horrific act of violence against women. Women need long-term compassion, not a quick-fix solution. Abortion does not reverse a rape. Studies have shown that abortion can seem like another violation and trauma for the rape victim and can increase the risk of mental health problems. Rape victims deserve better than abortion. Figures show that fewer than 1% of all abortions take place because of rape or incest. Up to 85% of the women who become pregnant through rape or incest choose to have their children. Abortion kills an innocent child for the crime of his or her father. Killing a child, regardless of how he or she was conceived, is always wrong. What if the mother is suicidal? At the government hearing on abortion in 2013, all the medical experts agreed that killing the unborn is never a treatment for suicide. In fact, evidence was given that women who undergo abortions are 6 times more likely to die by suicide. This advice was ignored by many of our TDs and senators, and as a result, abortion on a threat of suicide became legal in Ireland. Women need support, medication and compassion, not the trauma of abortion. The following 4-minute video allows us to hear a summary of the medical experts' opinions as presented to the Dáil.
The government wants to legalise abortion in Ireland on suicide grounds, but they are ignoring the evidence that shows abortion does not help women who are suicidal, and in fact it can hurt them. In January, the government held Oireachtas committee hearings and asked doctors and psychiatrists to give expert evidence on this issue. All of the medical experts agreed that abortion is never a treatment for suicide.
We've not had the experience of seeing any women who are suicidal where the appropriate treatment for their suicidal feelings would have been a termination of pregnancy.
St Patrick's Hospital submitted that there is no evidence, either in the literature or from the work of the hospital, that indicates that termination of pregnancy is an effective treatment for any mental health disorder or difficulty.
In my work as a psychiatrist, and I run the attempted suicide service in the Mater Hospital, where we see and assess over 400 attempted suicides in women per year. And I have never seen a pregnant woman who was suicidal for whom abortion was the only answer.
And none of the experts knew of a single case where an Irish woman had died by suicide because abortion was not available.
I'm not aware of any deaths as a result of suicide because a termination was declined to somebody.
Have we ever had to perform a termination of pregnancy because of risk of suicide? Not in my experience.
They warned that if a woman is profoundly depressed and mentally ill, she would be advised not to take any major life decision at that time, and that abortion was not a treatment for such cases.
If she's profoundly depressed and mentally ill, she would normally be advised not to take any major life decision at that time, and frequently admission to hospital.
The notion of even doing an emergency termination there is just, it's completely obsolete in terms of a person who's extremely suicidal.
The treatment for suicidality is to make sure that women are safe and that they have appropriate support, medication and psychological treatment. In fact, evidence was given that women who undergo abortions are 6 times more likely to die by suicide, and that abortion is hurting women.
There's another psychiatrist called Ferguson, who is actually a pro-choice person. He has done a lot of research on this, and he believes that abortion does increase overall the risk of mental illness post-abortion by about 30%.
The experts have spoken, and they agree that abortion is not a treatment for suicide. The government needs to listen to the evidence. Abortion is not the answer. See more at thelifeinstitute.net.
What if the baby has a life-limiting condition? Research shows that 90% of Irish parents do not abort their baby following a life-limiting diagnosis. Those parents have then been able to spend precious time with their children, both while the baby was in the womb and then for hours, days and sometimes weeks, months and even years after birth. These are our special children. They need love like all of us. Abortion not only denies parents precious time with their baby, it inhumanely and violently ends a child's life. Unborn babies with life-limiting conditions have a right to life. The phase, fatal fetal abnormalities, sometimes used to describe these babies, is not a medical diagnosis. Let's look at some of the real facts. The percentage of Down syndrome babies sentenced to death in the UK, 92% were killed. In Denmark, 98% were killed, and in Iceland, 100% of children with Down syndrome were killed. Remember, life doesn't have to be perfect to be beautiful. If the 8th Amendment is removed, then we could have doctors, nurses and ancillary staff in one hospital theatre killing a baby, and in another saving a mother and her baby's life. Is it right to put hospital staff in the position where they are duty-bound to save the lives of some babies, but kill others? It simply does not make sense and is unjust. Capital punishment in Ireland was prohibited in statute law in 1990. A constitutional amendment passed by referendum in 2001 prohibits reintroduction of the death penalty, even during a state of emergency or war. Capital punishment is also forbidden by several human rights treaties to which the state is a party. Is the state now intent on condemning innocent children to death before they are born? When asked to vote in favour of abortion, you may be told that you're only being asked to agree to the killing of those unborn babies that were conceived as a result of rape or incest, or because they may have life-limiting conditions. All these babies who are targeted for killing are innocent of any wrongdoing. We are being asked to vote in favour of killing them. Is that just? In reality, this will result in the killing of not one, but thousands of totally innocent unborn babies. You may ask, how can that be? The reality is that once a little abortion is legalised, then over a period of time, widespread abortion becomes the norm. This is the case in England, Scotland and Wales, where it is legal to kill unborn babies up to 24 weeks. even though a baby of 24 weeks can survive if born alive, or in the case of a baby with a disability. It is legal to kill the baby up to birth, which includes babies with Down syndrome. Today, over 200,000 unborn babies are killed every year in Britain, and 92% of all babies diagnosed with Down syndrome are aborted. Would it have been right to kill these babies before birth? Their parents chose life. What happens if you vote in favour of abortion? If you vote in favour of abortion, and therefore the killing of innocent babies in our hospitals, is anyone's life safe? Would you kill a baby? Then why ask a doctor to do so? Doctors are healers. Doctors are trained to save lives, not end them. Do not have the death of unborn babies on your conscience. Should we keep our constitutional protection for both mother and baby? The Constitution reaffirms the statement in the 1916 Proclamation, which resolves to cherish all the children of the nation equally. Or should we repeal the 8th Amendment to the Constitution, Article 43(3), thus rendering some children less equal in the eyes of the law? What happens if the 8th Amendment is removed? To remove the 8th Amendment from our Constitution would deny every unborn child his or her fundamental right to life and protection under the law before they can draw a single breath. In his article in the Irish Times, Professor Jerry White from Trinity Law School has stated that by simply removing the protection for the unborn opens the way for abortion on demand. The gift of life. Life is a gift. Do you know that no right to abortion exists in international law? The UN adopted the following statement: every human being has an inherent right to life. This right shall be protected by law. No one shall be arbitrarily deprived of his life. Every one of us received the gift of life. It is such a precious gift. Please do not deny unborn babies their right to life. Every time you say, it's a woman's right to choose, you're really saying, it's a woman's right to kill her baby. Should women have the right to choose? In other words, should any woman have the right to choose to kill her baby? We should all be allowed choices in life, but our choices should not include the right to hurt or kill another person. Abortion violently kills a living, growing child. Every person, born or unborn, has an equal right to life, without which all rights are redundant. It is now your right to choose. Do you vote to protect or kill the innocent? Compassion is the excuse used to support abortion, but killing a baby never equates to compassion. When you enter the polling booth to cast your vote, that decision is yours alone. It is your name that is on the ballot paper. Will you condemn the innocent to death, or will you save innocent lives? Donegal Pro Life wish to thank you for taking the time to view this presentation. Please make others aware about this grave human rights issue. And remember that every voice counts, just as every life counts. Life is so precious. Please protect it.